People of color and those living in lower income households in Denver are more likely to breathe in Denver's smelliest air. That's according to a new study from researchers at CU Boulder.
Researchers mapped out 265 facilities in Denver that had to submit an odor control plan. They found most of those facilities are in historically redlined neighborhoods along I-70 and I-25. And a prior study out of CU Boulder found those neighborhoods are also exposed to higher levels of pollution.
We're joined by Dr. Priyanka D'Souza, one of the authors of this new research. Thank you for taking some time to talk to us here on this Tuesday. Okay, well, let's start with talking about the city's smelliest facilities. They are historically in redlined neighborhoods. Can you kind of talk about why that is?
Unfortunately, because of a history of redlining, a lot of the industries and kinds of land use that nobody else wants around them have tended to be located in these areas because they have the cheapest land, people with the least ability to protest. And so there's a history of these facilities being located in Denver's notorious inverted L.
So for the individuals that are living near these facilities, what are the health risks, if there are any?
So odor has been known to have multiple health risks. For example, exposure to odor can cause stress. A lot of stress. But what's really interesting about our study is that although these facilities tend to be located in Denver's historically redlined neighborhoods, odor complaints are actually distributed widely across the city. And most of the odor complaints actually come from Denver's gentrifying neighborhoods. So it's interesting that there's a disconnect between where the facilities are and where the complaints arise from.
Well, you can drive through these areas, I mean, and it hits you over the head. You don't even have to have your window rolled down. So that part of the research definitely makes sense.
Yeah.
When it comes to fixing the problem, are you guys looking at some solution-based stuff as well?
So this study was done with the Denver Department of Public Health and Environment, and odor is a top concern for DDPHE. In fact, Denver has one of the most innovative odor ordinances of all cities in the US. Basically, their threshold to take action on odor derives from how many odor complaints they receive. And this is not the case for other cities. Other cities use this device called a sniffer to actually evaluate odor. But odor is so complex, it's so dependent on on someone's culture, on what they're used to, that a sniffer may not always pick up malodors, while odor complaints do. And so Denver actually takes action when they receive a certain number of complaints about a specific facility, and they require these facilities to submit odor control plans. Because odor complaints are so integral to this odor ordinance, it was very important for us to see who's making use of this mechanism and how does it compare with where we would expect odor complaints to come from.
If you have an overwhelming amount of complaints and you know that there's health risks or that odor can cause stress, can we move these facilities elsewhere so they're not near any populations?
I know that DDPHE is working with specific facilities to actually impose odor control plans. I think in worst case, in really difficult situations, DDPHE could ask facilities to move. I'm not sure if that's the case. I know that currently they're working with facilities to institute some sort of controls over the odors that are emitted.
Yeah, we've seen fines, time and time again, but it really doesn't seem to do anything. It doesn't move the needle because nothing, substantial has happened in this regard.
Unfortunately, it is a slow-moving process because so many, for example, Purina, from which a lot of odor complaints actually originated from, has so many parts of their manufacturing process that could emit odor that actually controlling odor from all of those different processes can be very difficult. I know DDPHE is working with them because so many odor complaints have arisen from Purina.
All right. Well, Dr. D'Souza, important topic. Thank you for spending some time with us this afternoon.
Thanks for having me.
Thank you.